Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Autism Diagnostic Observation Schedule assesses social interaction, communication, play, and restricted or repetitive behaviors. It is designed to evaluate individuals suspected of having autism spectrum disorder. The main purpose is to provide a standardized observation of behavior relevant to autism spectrum disorder diagnosis. The assessment includes structured and semi-structured tasks that elicit behaviors associated with the condition. Results contribute to a comprehensive clinical evaluation by qualified healthcare professionals. The Autism Diagnostic Observation Schedule is indicated for individuals suspected of having autism spectrum disorder across a wide age range, from toddlers to adults. It is particularly valuable for patients with unclear developmental histories or when direct observation of social communication and repetitive behaviors is necessary. The assessment is most useful in clinical contexts, requiring standardized evaluation to support diagnosis, treatment planning, or research inclusion. It provides objective measures in settings involving developmental, psychiatric, or neurological evaluations where differential diagnosis is challenging. The Autism Diagnostic Observation Schedule consists of a series of standardized activities designed to elicit behaviors relevant to autism spectrum disorder diagnosis. The clinician selects the appropriate module based on the individual's age and language level. Each module comprises between 14 and 30 tasks that assess social interaction, communication, play, and restricted or repetitive behaviors. Questions and prompts are presented in a semi-structured format, allowing for naturalistic observation. Responses are scored on a 0 to 2 scale, where 0 indicates no abnormality and 2 indicates clear evidence of impairment. After completing the session, the clinician sums the scores across specific domains to generate a total score. This total is then compared to established cutoff values, which vary by module and age group. For example, in Module 3, a total score of 7 or above suggests a likelihood of autism spectrum disorder. Scores falling below the cutoff indicate behaviors within typical developmental ranges. The assessment also provides calibrated severity scores ranging from 1 to 10 to gauge symptom intensity. Higher scores correlate with greater symptom severity and can inform treatment planning. Accurate interpretation requires integration with clinical judgment and other diagnostic information. The Autism Diagnostic Observation Schedule demonstrates sensitivity values typically ranging from 0.8 to 0.95, indicating its ability to correctly identify individuals who have autism spectrum disorder. Sensitivity reflects the proportion of true positive cases detected by the test. Specificity values for the instrument generally range from 0.7 to 0.9, representing its capacity to correctly classify individuals without the disorder. Specificity measures the proportion of true negatives correctly identified. For example, a sensitivity of 0.9 means that 90% of individuals with autism are accurately detected, while a specificity of 0.8 indicates that 80% of individuals without autism are correctly excluded. These metrics are essential in clinical settings to minimize false negatives and false positives during diagnostic evaluations. The Autism Diagnostic Observation Schedule was developed in the early 1990s by Catherine Lord and colleagues as a standardized observational assessment designed to facilitate diagnosis of autism spectrum disorders across diverse age groups and developmental levels. Validation studies conducted during the initial development demonstrated high inter-rater reliability with kappa values exceeding 0.8 indicating consistent scoring between clinicians. Subsequent research involving normative and clinical samples supported the instrument's ability to differentiate autism spectrum disorders from other developmental conditions, with sensitivity estimates frequently reported above 85% and specificity values near 90%. Additionally, factor analyses confirm the test's two-domain structure, assessing social communication and restricted repetitive behaviors, aligning with diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders. Cross-cultural studies have further substantiated the applicability of the instrument across varied populations, while longitudinal research has shown its utility in tracking symptom changes over time. These combined findings provide a robust empirical foundation for the Autism Diagnostic Observation Schedule as an essential component in the diagnostic evaluation process for autism spectrum disorders. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.